Are you aware that diabetes might have nocturnal symptoms? You might not think about this subject. However, being aware of the symptoms of this widespread but dangerous illness can make all the difference. In this article, we'll look at the subtle but important symptoms of diabetes which frequently appear at night. These nocturnal indicators can provide important information about possible underlying medical issues. Please let us know if you experience any of the following symptoms in the comments section. First, a preliminary sign. Diabetes can cause frequent urination because the condition causes excess sugar or glucose to build up in the bloodstream, which puts a strain on the kidneys. If the kidneys are unable to keep up, the extra glucose is excreted in urine, which pulls fluids from your tissues and increases the frequency of urination. If you find yourself waking up several times during the night to empty your bladder, your sleep pattern may be disturbed, and this could be a sign of diabetes. This physiological reaction, which can be a warning sign for diabetes, is your body's attempt to eliminate the excess sugar. Secondly, nocturnal sweats are another important symptom. To take into account is night sweats. If you frequently wake up in the middle of the night soaked in sweat, this may be an indication that you have diabetes. Nocturnal hypoglycemia, or low blood sugar during the night, is usually the cause of night sweats. This occurs when your body responds to low blood sugar by releasing emergency hormones, which causes profuse perspiration. Changing food habits and medicine dosage can also help diabetics manage their night sweats more effectively. However, these adjustments should only be undertaken under professional supervision. Before we go on to the next symptom, don't forget to like and subscribe. Thirdly, symptoms of low blood sugar, hypoglycemia. Symptoms include not only trembling and sweating but also a considerable increase in hunger and bewilderment. At night, one may experience heart palpitations and hazy eyesight. The most prevalent comorbidity of hypoglycemia or low blood sugar is diabetes. The reason these symptoms are more common at night is that the body needs energy during rest, and when glucose levels fall, the body responds by exhibiting these symptoms in an attempt to indicate when a glucose increase is necessary. Eating balanced meals and regularly checking blood sugar levels are necessary for treating these symptoms. Additionally, it's important to discuss any medication with healthcare providers because some medications can alter blood sugar levels. In certain situations, a snack that contains complex carbs and protein at night may be advised to maintain stable blood sugar levels throughout the night. Our fourth symptom is restless leg syndrome, a neurological ailment that is fairly common but is frequently underestimated. It is characterized by an intense and uncontrollable urge to move your legs. This craving is frequently accompanied with odd and painful feelings in the lower legs. The symptoms, which are really hard to explain, have been compared as aches, tickles, or even a crawly feeling. At this point, you might be wondering how this syndrome is related to diabetes. The nerves are actually where the connection is made. Continuous elevated blood sugar levels. Peripheral neuropathy, a common complication of diabetes, is a disorder that can damage your body's nerves over time and contribute to the development of restless leg syndrome. It could be a good idea to have your blood sugar levels examined if you've been experiencing discomfort or an insatiable want to exercise your legs. Damaged nerves convey jumbled messages to the brain, which causes the impression of needing to move the legs constantly. The fifth place on our list goes to sleep apnea, a sleep-related condition marked by frequent breathing pauses during sleep. These pauses, also known as apneas, can occur many times during a night, resulting in intermittent sleep and frequently leaving the person feeling tired the next day. The connection between sleep apnea and diabetes is particularly noteworthy. Research has shown that people with diabetes, especially type 2 diabetes, are significantly more likely to have sleep apnea. The reasons for this are numerous, but one important one is that both conditions are linked to obesity. When excess fat builds up around the neck area, it can obstruct the airway, causing sleep apnea. Additionally, moving on, insulin resistance can result in abnormalities in the body's energy consumption during sleep, which can cause breathing disturbances. This intricate interaction of elements raises the risk of sleep apnea in those with diabetes. Increased thirst. Also referred to as polydipsia, this symptom occurs when high blood sugar levels force your kidneys to work harder over time to filter and absorb the excess sugar. When they can no longer keep up, the excess sugar is excreted into your urine, dragging along fluids from your tissues. This leads to more frequent urination, which may leave you dehydrated, which is why you're experiencing increased thirst. To effectively manage this specific symptom, you should regularly check your blood sugar levels, maintain a balanced diet, engage in regular physical activity, and take any recommended medication. It's important to speak with your healthcare practitioner to determine the best course of action. Don't disregard excessive thirst, particularly if it's accompanied by other diabetic symptoms. Your body may be trying to tell you that something is wrong. A warning symptom of diabetes is persistent fatigue. If you consistently feel exhausted even after getting the recommended amount of sleep, this could be a sign of the disease. Fatigue in diabetes is brought on by the body's inability to use glucose as an energy source effectively. If you have insulin resistance or are unable to convert food into energy because your body is not producing enough insulin, you may experience persistent weariness because your cells are not getting the glucose they need to function at their best. Maintaining stable blood sugar levels is essential for managing diabetes-related fatigue. This can be achieved through regular exercise, a balanced diet, and routine checkups with your doctor. Making sure your body gets enough sleep and minimizing stress are also key components of managing diabetes-related fatigue. Another noteworthy symptom to watch out for is dry mouth, medically known as xerostomia. It is characterized by a lack of saliva. Even though people are keeping adequate hydration levels, they may find that they wake up frequently with a parched mouth, which may be an indication of diabetes. Dry mouth is a symptom that develops when blood sugar levels are high because they might reduce salivary flow. Additionally, increasing blood sugar levels can cause increased urine, which can cause dehydration and ultimately dry mouth. Maintaining proper dental hygiene is necessary for controlling this ailment. In addition to drinking plenty of water and, if needed, utilizing saliva stimulants or replacements, sucking on sugar-free sweets or chewing sugar-free gum can also assist to increase salivation. It is always advised to speak with a healthcare provider in order to correctly identify and treat this illness. The last thing to consider is the possibility of sleep disruptions. If you experience various forms of restlessness at night or insomnia, these could be connected to diabetes. Diabetes patients frequently experience persistent sleep problems because their bodies are unable to control blood sugar levels, which can lead to hypoglycemia at night. On the other side, hypoglycemia, or high blood sugar, can produce frequent urination, which can result in many nighttime bathroom trips. Hypoglycemia, or low blood sugar, can create symptoms like sweating and shaking that might wake you up in the middle of the night. The usual treatment for these sleep disturbances is to better control blood sugar levels with medication, diet, and exercise. Cognitive behavioral therapy is also helpful in treating insomnia. So if you're having problems falling asleep, it's important to think about the possibility of diabetes and see a healthcare provider for an accurate diagnosis and treatment. To summarize the symptoms of synopsis and resolution, diabetes symptoms that might manifest at night include hypoglycemia, symptoms such as night sweats and frequent urination, leg restlessness, syndrome apnea, during sleep elevated thirst, exhaustion, dry mouth, and sleep difficulties should be kept in mind as potential signs of diabetes, but also as indicators that further testing may be necessary. The best course of action is to speak with a healthcare provider if you're feeling any of these symptoms. Diabetes is a global health issue that impacts millions of individuals. Understanding the symptoms, particularly those that appear at night, can aid in the early diagnosis and treatment of the condition. Remind yourself to pay close attention to these signs. If you have one or more of these signs at night, contact a doctor. Thank you for taking the time to watch this video. If you enjoyed it, be sure to hit the like and subscribe button. Help me to give everyone as much information as possible about our health. After all, we only have one, so we have to be careful with it.